everyone, welcome back to my YouTube channel. Today we are going to talk about anatomical plane, and here at the side you can see the diagrammatic representation of anatomical plane for the reference. Talk about the introduction of anatomical planes. Anatomical planes are essential for describing location and movements of different body parts. These imaginary surfaces help in understanding how to slice the body into consistent sections, which is especially useful in medical imaging, surgical procedures, and anatomical studies. Now let's talk about the types of anatomical plane. These are sagittal plane, frontal plane, transverse plane, and oblique plane. First three are the main anatomical plane, and the fourth one is accessory anatomical plane. Now let's talk about these anatomical planes one by one. Let's start by sagittal plane. Definition: sagittal plane is a vertical plane that runs from front to back, thus divide the body into right and left portion. It has two types, that is mid-sagittal plane, that is also called as median plane, and the second type is parasagittal plane. Mid-sagittal plane or median plane is a specific sagittal plane that runs exactly along the midline of body, creating equal right and left halves. While parasagittal plane is any sagittal plane that does not run along the midline and results in unequal right and left halves. Further talking about sagittal plane, their anatomical importance. This plane is crucial when describing bilateral symmetry, identifying medial versus lateral structure, and explaining movements such as flexion and extension. Talking about medical applications, sagittal sections are commonly seen in MRI and CT scans of the head, spine, and pelvis. Neurosurgeons use this plane to locate and operate on midbrain structures. Next plane is frontal plane. Talking about definition, frontal plane divides the body into anterior and posterior portion, or into the front or back portion. It runs vertically but is oriented side to side, so it is perpendicular to the sagittal plane. Talking about anatomical importance, it helps describe features located towards front or back of the body. Movement in this plane often involves abduction and adduction, that is, moving limbs away from the body or moving the limbs towards the body. Talking about medical application, frontal planes are especially useful in chest radiographs or X-rays showing the heart, lungs, and ribs. Orthopedic surgeons utilize coronal views to assess spinal curvature and joint alignment. Now the next anatomical plane, that is transverse plane. Talking about definition, these planes run horizontally across the body, while other two planes we talked, the sagittal and frontal plane or coronal plane, runs vertically around the body, but this plane, that is transverse plane, that runs horizontally across the body, and it divides the body into superior and inferior parts, or it divides the body into upper and lower parts. It is perpendicular to both sagittal and frontal planes. Talking about anatomical importance, it offers a sliced view of the body, allowing clear observation of cross-section anatomy. Movements such as rotation often occur within the plane. Talking about medical application, transverse imaging is frequently employed in CT scan and MRIs, particularly for the brain, abdomen, and pelvis. Surgery rely on these views for planning laparoscopic and robotic assisted procedures. Now let's talk about oblique plane, that is also called an accessory anatomical plane. Definition: oblique plane is any plane that passes through the body at an angle that does not follow the standard sagittal, frontal, or transverse orientation. Anatomical importance: oblique plane provides unique perspectives that standard planes may miss, especially for complex or curved structures. Medical application: they are indispensable in advanced radiographic techniques such as spiral CT scans. Oblique slices may be used to view joints like the shoulder or hip or irregular body cavities. Let's talk about the functional relevance of these anatomical planes. Each plane corresponds with specific types of body movements. Like sagittal plane, there is flexion and extension movement related to it, that is bending the knee, or the example is the bending the knee. Second is frontal plane. The movement related to it is abduction and adduction. Third is transverse plane, and the movements related to it is rotational movements. Now let's talk about clinical significance of these anatomical planes. Clinician relies on these planes for precision in diagnosing injuries, planning physical therapy, and conducting surgery. For example, when describing a stab wound or a tumor's location, doctor refers anatomical planes for clarity and consistency. Now let's talk about conclusion of this lecture video. Mastering anatomical plane is more than academic. It's a vital skill for anyone entering healthcare or biology. These invisible lines bring order to the complexity of human body, enabling clear communication and precise medical care. Whether you are studying a skeleton or guiding a scalpel, anatomical plane provides the essential map. And this was all about anatomical plane. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.